dulce.
Ano to?
Magdali, bayo.
3, 2,
I'm
1.
Aliani Colcinco from BS115 and I will be assessing the neurovascular and musculoskeletal system. So first, we must identify the patient, ma'am, your name and your birthday.
The skeletal and the neurologic system of the patient. So first is we're going to
Next,
identify
to explain to the patient the procedure and answer any questions if there are any for the patient. So ma'am, I will be assessing the neurovascular and vascular system. So for me to be able to know if you have any underlying conditions to worry about. And if you have any questions, ask away. Okay. Next is to perform hand hygiene.
check if there is any
Next is to help the patient undress and provide patient care. Next is to survey first the overall appearance, the overall hygiene and physical appearance of the patient. Next, now we will be starting, we will start assessing the neurovascular system.
after performing
So first, we must assess first the mental status of the patient. First, to evaluate the patient's orientation, the patient's orientation to person, place, and time. So ma'am, in the beginning of who I am, and may I know again,
we're going to
Give
give the survey for our patient,
Asa man tahanan ma'am?
patient hygiene and
Kamu
physical
naman sa naura sa
appearance.
karon ma'am?
First, assessing the neurovascular system. First, we're going to assess the patient's mental
Next is to
status.
evaluate the level of consciousness of the
Mental
patient.
status, we're going to
Next,
ask the
we're going
patient.
to access the memory of the patient by asking the patient or recall a past memory of the patient. So ma'am, what's yung ikaulin mo na ng bukas? Paste.
Balo ka sa karoon.
Sure, Jud ma'am.
What? Saan na tawag sa ma'am?
Next is to assess the
Next, we're going to assess the patient's
Next is to assess the abstract reasoning of the patient by asking the patient to explain a certain
abstract
proverb.
reasoning by
So
asking the
ma'am,
patient
kabalo ko sa one ma'am, an apple a day keeps a doctor away.
the word. So, ma'am,
Next is to assess the level of
evaluate the patient.
abilities for the patient to understand by asking the patient to read, by asking the patient
So the meaning of the early word touches the word and limatawag sa inyong
written and spoken materials by following my command. Ma'am, babasa ka. Kani, basa ka lang, ma'am.
Next is we're going to assess the patient's
Next,
read.
after that is we're going to ask the patient to
Letting the patient follow our
ask the
commands.
patient to close their eyes and identify the object that I will be putting on their hand. So, ma'am,
Count 1 to 20.
wala lang sa kamot.
After that, we're going to
And ask the patient to close their eyes upon one nostril and ask the patient to smell and identify the scent. So, ma'am, simulan ni ma'am yung nakapagsabihan.
assessing the patient's cranial nerve kasi go assessing the patient's cranial nerve function. We're going to ask the patient to close
And
both
do
eyes
it another side.
to one nostril. Okay, ma'am, close your eyes.
Next, we're going to ask
And we're going to
the patient to use their hands.
let the patient smell a substance.
We're going to assess the cranial nerve function. So next, we're going to place our hand on the patient's shoulder and ask the patient to shrug against it. So, ma'am, next, we're going to ask press the patient's ay, so open eyes mo press the patient, your hands on the patient's cheek and ask the patient to push against it. And do
Next is we're going to inspect the patient's
Next, we're
ability
going
to
to
the patient's
ask the
neck.
patient to touch their chin on their chest,
to chin
give
to
one
chest,
arm, chin to
chin to
chest,
shoulder,
chin to
another
shoulder,
shoulder,
chin to the other
ear to
shoulder,
shoulder,
and ears,
chin to chest,
and the other side,
chin to shoulder,
and tip your head as far as possible.
ear to shoulder, ear to shoulder.
Next, wrong one again. Next is to ask the patient to
Next is ask the
close their
patient
eyes
to
and
close her eyes,
swing your hand
close
and
her eyes,
identify the object
and
that
we're going to give the patient an object to let the patient identify one object.
and another object on the other side of the hand. Next, we're going to ask the patient, still closing the eyes, by using a finger applicator, we're going to draw a single digit number of the patient's hand, and ask the patient to
Next,
identify
we're
what
going to give
number
another object
or
to
what
the patient.
and another number on the other side of the
After
hand.
that, we let our patient close her eyes again, and we're going
Next,
to
we're
draw
going to assess the deep
trace
tendon
along
reflex
the
of the
patient's
patient.
hand.
So, in assessing the deep tendon reflex, we need a reflex hammer, and we're going to tap it on
Ang other side, ano ba?
what na? What na? 2 7.
Next is we're
So,
going
first
to
is the wrist.
assess the patient's tendon reflexes. So first, we're going to assess the wrist first.
Dapat na may ate.
Laro ba na? Wala ate.
And also the anti-cubital area of the patient.
Next is the triceps tendon.
After that, we're going to go to the patient's triceps to check the tendon reflex.
Next, the patellar reflex. And lastly is the Achilles.
Nagtangang
Ay,
shoot.
okay, remember.
Next, we're going to, after the tricep or tendon reflex, we're gonna go to the patient's patella to check the tendon reflex.
Na?
After that is we're going is next is using the tip of the hammer. We're going to pwede kang higda.
Going to proceed to the patient's Achilles.
We're going to stroke the sole of the feet of the patient. Bottom. And do it on the other side of the feet. Next is we're going to
After that, we're going to
ask the
stroke
patient
sole
dorsiflex
of
and
the
plantar
patient's
flex.
foot.
So, follow me kung hindi ko ni sir. Push. This is to assess the strength of the patient's road.
That,
Dapat nag-reading sa mga
Okay, next we're going to ask the patient to stand up. Ask the patient to stand up and walk. Ask the patient to walk at a regular gait.
Asa? Tanawon daw ng video.
ay,
Yeah, heel daw. Heel daw. Heel na.
Uy, basta ba yun?
Ako ginapuan, sir.
another.
Yeah, balik and use the heel, foot,
Weird kayo.
Assessing the patient's sole foot, we're going to ask the patient to do
Next, we're going to perform the Romberg's test. So in performing the Romberg's test, we're going to ask the patient to close their eyes and hands on the side and ask the patient to stand for 20 seconds and stay alert whenever the patient loses their balance.
Next is we're going to ask the patient to a standing position. And ask the patient to walk
Next, we're
normally.
going to assess the musculoskeletal system. So in assessing the musculoskeletal system, is we're going to first we're going to ask the patients to stretch their arms and rapidly turn your palms up and down.
Balik.
Next, we're going to ask the patient to flex their arms and ask the patient to resist the force. So after that is we're going to inspect the hands, the fingers, the wrist, and the elbow joint for any
After
tenderness.
that, we're going to perform the patient's Romberg's test. In assessing the patient, we're going to ask the patient
After that is have the patient
on
bring
side of the patient,
fingers
and we're going to assess the
assess the
patient.
strength of the patient's
Close
upper
the
lip.
patient's eye and count to 30
Next is we're
seconds
going to,
and note for the patient's pulse.
ask the patient to
Hold that.
lay down and ask the patient to perform the straight leg test. So in performing a straight leg test, we have to ask the patient to raise the legs and do it on the other side of the side.
What time na?
And lastly, we're going to assess the patient's abduction and abduction of the hips. So ask the patient
Musculoskeletal system.
to move
In
his
assessing
legs
first, in
laterally
assessing the
and immediately.
musculoskeletal system
So
of the
to
patient,
know the
we're
abduction
going
and abduction of the hips or the hip movement. So si anak ma'am, si anak
We're going to ask the patient to extend arms forward and rapidly towards the palm and the dorsal
Next
line
is
of the
to
patient.
the thigh. So we have to ask
After
the
that, we're going to ask the patient to flex the
patient to
force
give to force
this is
their
like seminar opposing sex.
si anak mo sa phone. Yeah, ako ito. And do it on the other side.
One at a time.
And
After that, we're going to inspect and palpate the patient's hands, wrists, and joint of the elbow. One at a time.
And now, we're going to assist the patient in a comfortable position.
Like the abduction na, paano mga abduction,
Oh, nag-ano?
Pero wala na siya nag-mention, sir.
Next is perform hand hygiene. Perform hand hygiene and document everything.